Hello all, welcome to the show. I'm Gus Gagliardi and this is Fire Code Tech. On Fire Code Tech, we interview fire protection professionals from all different careers and backgrounds in order to provide insight and a resource for those in the field. My goal is to help you become a more informed fire protection professional. Fire Code Tech has interviews with engineers and researchers, fire marshals, and insurance professionals, and highlights topics like codes and standards, engineering systems, professional development, and trending topics in the industry. So if you're someone who wants to know more about fire protection or the fascinating stories of those who are in the field, you're in the right place. Hello all, welcome to episode 18 of Fire Code Tech. On this episode of Fire Code Tech, we have Josh Brackett. Josh is a fire protection engineer who specializes in healthcare occupancies and facilities maintenance. On this episode of Fire Code Tech, we get into what does it look like to perform inspection, testing, and maintenance for a campus of healthcare facilities. Josh gives us a look at what are the differences between healthcare occupancies and your standard commercial business occupancy. In episode 18 of Fire Code Tech, we talk about Josh's company, Legacy FM, a company where he specializes in how to train your facilities maintenance technicians and staff the best practices and codes and standards for the industry. We go over Josh's involvement in the codes and standards creation process. Then we break down Josh's two big takeaways from how the pandemic has changed the way healthcare occupancies operate. Don't forget to subscribe wherever you get your podcasts and follow us on social media. Let's get into the show. I've been watching your videos for a while, and it's been great seeing somebody who knows what they're talking about get into fire protection, and it's remarkable to me that there are just not very many resources out there on YouTube or just in general for people describing fire protection systems, or just, especially even more niche, I think, is inspection, testing, and maintenance. So yeah, it's kind of wild to see you in that space and just realize how wide open that space is for information and content. But it seems like a lot of people have been responding positively to what you've been throwing out there.
Yeah, they have been, and it's been a lot of fun. Honestly, I've really enjoyed it. There's always I think there's always a few people that disagree or kind of the naysayers, but yeah, you're right. The majority of people are very excited about it, and it's really cool to kind of see it just keep growing and seeing other people uh, share it or be involved in it, or I'm starting to see a couple of other people who are starting to do videos, which is great. That's what I want. I mean, let's share our knowledge and get the information out there. The more people that we get talking about it, the better our industry is going to be.
Yeah, without a doubt. I mean, to stimulate the conversation and distribute the information and lower the barrier to entry for professionals, I think is the ethical thing to do. Sometimes I feel like our industry, it likes to have this like knowledge barrier or expertise barrier for people to get involved with fire protection and life safety work. And I was talking with somebody recently, was saying, this is like the law and life safety. The whole idea of what we do is to make safer buildings. So yeah, I think that's a noble pursuit to push for safer buildings and better information for professionals. So that's pretty neat. So I don't know if it was this week, but I saw you're at that SASHE conference and that you had a talk going on. Was that this week?
Yeah, that was last week. Yeah, I had one on Monday and then one on Wednesday.
That's awesome. That's awesome.
Yeah.
Have you had a lot of experience speaking at conferences and stuff?
I have. I don't know. I've probably done a dozen or so live presentations, and probably about another dozen or so webcasts or webinars.
Yeah, it's that's not an easy thing to do. I was trying to for our local SFPE chapter this year do a presentation over a webinar, and I thought I had plenty of content, and I was struggling after and I'm not afraid of uh, like presenting or whatever, but I was like about halfway through, I was like, man, I needed more slides and more bullet points, and it's definitely a skill, and it's not easy. So
It is not. No, it's very difficult. Webinars are very hard too because you're there's very little feedback during them. I mean, so especially if it's just a webinar, and you can't see everybody, and you see, oh, I'm talking to 3, 4, 500 people, and I have no idea if number one they can hear me or any kind of response back. So
yeah, you could be having connectivity issues, or maybe you're breaking up and you didn't know, and there's no feedback from people's faces. A lot of times, people will have their video off, and yeah, that's kind of bizarre.
it is.
But anyways, yeah, I'm excited to have you on the show. I'm excited to get into some areas I haven't had the opportunity to talk with anybody about on Fire Code Tech. Talked about iTeam a little bit, but I'm excited to talk to you about healthcare and just your background in healthcare. It seems, I think, fire protection is already so niche and just a very specialized thing, but I'm always interested in drilling down into further, more specialized categories of fire protection. So I'm excited to talk to you about healthcare and your background because I think healthcare is a really interesting and complex niche within fire protection, which is already a pretty obscure niche topic in itself. But yeah,
Definitely. Yeah.
yeah. So I just wanted to kick the interview off and get started with, yeah, letting the listeners know a little bit about your background and how you've got into the fire protection space and what you're doing now.
Sure, absolutely. So I actually started out. All I wanted to be my whole life was a firefighter, and I think a lot of fire protection engineers kind of start out that way, secretly or openly, right? But and that's what I wanted to do, and I graduated right at the end of the 2008 financial crisis, and I was just applying left and right to fire departments. I got to the final interview several times, the chief interview several times at several departments, and just kept being rejected, man. And the last one that I got to that chief interview with, we had some sort of, I remember it like it was yesterday. Had a hose coupling assembly, that you had to do in front of him. They showed you a picture for a couple of seconds, and you had to do it from memory. And I sat down afterwards, and he looked through my packet and he said, "I'm not going to hire you." And I was like, "Well, I have another 58 minutes. Can I?" This is continuing to happen to me. What's going on? Like, why? And he said, "Man," he's like, you've already graduated with your fire protection engineering degree. Why is this what you want to do?" And kind of took me aback. So 2 days later, I got a phone call from a company I had interviewed with 2 years before, and they said, "Hey, we want to your wife's now graduated from college, which was the reason I didn't take the job before." And he's like, "Hey, do you want to come and interview again?" And I was like, "You know what? Why not?" Clearly, the firefighting route wasn't meant to be. So I'll take a stab at this, and ended up getting the job. Um, and kind of the rest is history from there. And then it's been a pretty diverse career since then. Then, I really kind of before that, it's been several things that have shaped my career. It's been even before college, right? If we take a step back, before that, I actually co-owned an appliance repair company with my stepdad, and it was a good chunk of what put me through college. Gave me the funding to get through college. And had a couple of different internships. Figured out what I liked, what I didn't like. Worked at ConocoPhillips on the safety side for a little bit. Not really what I was feeling. It's didn't align with kind of my passions and what I was thinking. I actually helped do the build out of the half dome of the OSU stadium with a sprinkler company. Found out that slinging pipe around was really hard work, and decided that wasn't what I wanted to do. Um, Spent a little bit of time on an ambulance service did some volunteer firefighting, and then and that kind of all led me to that engineering company. I got there and I already had a good idea of what I didn't want to do, and started doing fire protection engineering. Started out on the sprinkler side solely, and at that company that I was at, the electrical engineers actually did all the fire alarm design and things like that. And like most companies, it's hey, very minimal design, both on sprinkler or on fire alarm. It's kind of hatch jobs is what I call them, right? And more of the governance of having the engineers to be able to look through submittals and things like that. And man, I really started pushing the boundaries on that. And I said, so we can grow this. I said, there's fire protection engineering companies out there, and we could keep growing this. And and there was this kind of innate desire. I'm not like a normal engineer in the sense where when most people think of engineers as kind of generalized they like to keep to themselves, and they're not very outgoing, and they're great at calculations and stuff like that. And I actually, that was more of my weakness, I would say, more than anything. I really enjoy talking to people, poking holes in things, redlining drawings, working with the contractors, figuring out better ways of doing stuff. So we actually had the company had a whole bunch of electrical engineers leave all at one time, and I said, hey, I took a fire alarm design class in school. Surely I can do that. And that's kind of where my love of fire alarm started, and it was a blast. I loved learning. Just dug in deep into. What's one thing that I've always enjoyed is when I get something new, I just read and I dig and I find as much as I can on it, and just the kind of the love for learning. Some people live to learn, and others like learn to live or whatever. And but I really enjoy it. So I kept growing in that role, and I actually took a business case to. I was the first engineer to bridge the gap between what I would call mechanical fire protection and electrical fire protection, right? So, and I was doing both roles on these projects, and I loved it because there was less coordination, it was less, that's one of the downsides of having so many disciplines is there's a lot of coordination that has to go into it. But I saw this opportunity to really grow this, so I presented a business plan to the board of directors at the engineering firm, and it wasn't the next day, but that's kind of like the story that I tell. The next day they made me director of business development. So, um, and and that just opened up so many doors, so many opportunities. It taught me a lot about the public speaking and dealing with clients and learning what clients need, more so than just the engineering, right? And but my love for fire protection engineering never went away. And so I was working on growing the whole engineering firm holistically, and the engineering firm they kept growing. Ended up becoming they were already national to begin with, but ended up becoming even larger. That went through a big merger, and it was kind of at that time that my wife and I were starting to start a family and all of that. She actually worked at the engineering firm as well, and I was like, nah, I'm not gonna. I'm tired of sleeping in a hotel every night, so ended up finding a local job working for a fire alarm and sprinkler contractor, doing business development and client growth there, as their chief business development officer. And I learned a lot about the contracting side, and I learned a lot about the issues between engineered drawings and contractor drawings, and going through it and trying to figure out. I realized it's a very, very broken process. I also realized that the contractor's world was not where I wanted to be. It wasn't a good fit because I very much have a very, very strong ethical view of fire protection and life safety. I've never been one to cut corners, and I'm not saying that the company did. I'm just saying that it the owners especially, it's hard to convince somebody on a low bid, you know, how to do the right thing. And it's just there was this huge educational gap on what the right thing was. So I decided to leave that company, and I was like, I'm going to start my own thing, and that was kind of in my brain. But I was doing a lot of work at that time for the place I currently work, Baptist Health Hospital, and I was actually managing. There were some issues that we were having with their Joint Commission reporting. So I got really, really heavily into the ITM side then, and developing the processes and procedures for that, because I saw it as an opportunity. I started doing a lot of market research and found that there really wasn't a company out there doing it right. So I saw this huge opportunity to develop this and take it and take our small local contracting company national. And I've always tried to bite off more than I can chew. So Baptist calls me though when I decided to leave. They said, "Hey, we got this position. We want you to join our team. We'll figure out all the details. Let's go." So I applied. They interviewed me. I got the job, and that's as a special projects manager there. And special project manager does, initially it was really, hey, we need to sprinkler our high rise building, and we need to develop this ITM program, and our fire alarm systems are starting to fail. And so, but that quickly grew into, hey, we're going to insource a construction team. Hey, we're starting to handle energy management, which was another thing that I did for the engineering firm previously. So it's just kind of just kept growing and growing, and I love every aspect of it. And then decided to start my own company with my wife, co-founded Legacy FM, and it goes back to that kind of holistic view of what we do is develop custom training programs for healthcare facilities teams, realizing that there's a gap in the industry from a learning perspective. The skilled trades. There's not a whole lot of education and training out there for them, especially the on the job side of it. So, learning how to do refrigeration or run a central plant or whatever that, those kind of courses exist, but there's a whole lot that goes into healthcare facilities management that there's just no training for the technicians on.
Man, what a remarkable story of your experience. You've really run the gamut
I
on
have.
the different avenues of the career that you could pursue as a fire protection professional. I mean, you said you had some experience with safety, and your initial experience with the with engineering, and fire suppression and fire alarm design. That's remarkable, man. You have a pretty diverse background. I'm sure that's a big help for you now, um, knowing what it's like to sling pipe, and also being on the construction or the design side of things. So that's pretty remarkable.
It is. I mean, I've been very blessed, um, and that's how I look at it. Is that I haven't had a whole lot of career changes over my career, but the ones that I have, I've learned so much from them, and I've had some really great mentors, and really have been able to explore my passion and hone in on my passion. Not everybody can say that, so I just consider myself very blessed.
Yeah, I really like also what you're saying about uh, being a constant learner and trying to keep professionally developing and seeking new challenges and new pursuits in your career. That's something that I resonate with, and would like to think about myself as well. But yeah, that's awesome. So you gave a pretty comprehensive outlook on your background. It's really interesting. Yeah, I wanted to get a little bit more into healthcare, but before, I was really interested when I was taking a look at your profile. I saw that you had some different certifications that I wasn't real aware of. I didn't know if you would speak about SASHE. Is that how you say it? And
Yeah,
your
yeah,
your CHFM certification.
that's right. Yeah, definitely. So, SASHE and CHFM are both designations from ASHE, which is the American Society for Healthcare Engineering, and they're a professional membership group of the American Hospital Association. So, and it's an organization that I am heavily deeply involved in from multiple different aspects, and I love them. I love everything that they do. But that's our organization for healthcare engineers, and it's a big chunk of how facilities managers get their continuing education and stuff like that. So, and the SASHE designation is very similar to like the SFPE side. There you have FASHE, or I mean you have the fellows for SFPE. So there's a step here in ASHE before you get your fellow, you become a senior, which is what the S stands for. And to be a senior, you have to have, I think it's like 5 years of membership experience, and you have to have some pretty great contributions through. They have three kind of segments: leadership, education, and publishing. The education could be through webinars or through in-person presentations and delivering presentations, things like that. So and I'm one of the youngest members to ever get his SASHE. I heard at one point I was the youngest. I don't, unverified. So, but and then the CHFM is the Certified Healthcare Facilities Manager designation, and it's a it's kind of the benchmark for knowledge of facilities managers. And there's 5 different pillars to that. There's compliance, planning, design and construction, maintenance and operations, finance, and then administration. And it's a very difficult. You have to have number one. You have to. I think it's like 3 years or so of experience to take the exam. But then it's a very difficult exam to pass because it's such a broad topic of knowledge and it's closed book. And I mean, you really, especially once we get to talking a little bit more about healthcare, I think the audience will understand like the complexities associated with it. And it's got a very low pass rate. So,
Yeah.
so much so that I actually wrote a LinkedIn article about like what I did to study for it. And I passed, but I barely passed. So
Man, yeah, and the fire protection PE, which are also a PE, has a pretty low pass rate too. It has the third lowest of any PE exam. So
it does. And I
yeah,
kind of looked at it like when I took my PE, I like to joke with people about my boss at the hospital is actually a mechanical engineer, and so he and I kind of joke back and forth a lot. And I asked him, I was like, "How many books did you take to the exam?" And he's like, 13. And I was like, "I took like 30." So
yeah,
but I like to joke that fire protection engineering is as niche as it is still so it's so broad. There's
yeah,
so much that we cover. So
for sure, without a doubt. Yeah, it's pretty weird when you tell people who maybe aren't so acquainted with the PE that you had to take like crates worth of books to the exam. But
yeah,
it's
yeah.
it's kind of wild that all stops with this exam coming up, and it'd be the last paper exam was last year, so that's kind of crazy. But yeah, I wanted to get into more of maybe for those who don't know, or just to expand upon it a little bit. I wanted to hear from you, like your perspective on what ITM is and what facilities engineering, means in the context of what you do now and healthcare facilities.
Absolutely. So ITM, is clearly, for those listening, inspection, testing, and maintenance, right? And that's a very broad term that actually applies throughout all of facilities engineering, but it's especially referenced in the codes, NFPA codes, which is our primary go-to. And oh boy, so healthcare facilities engineering in general, just facilities management, facilities engineering. I'll use those terms interchangeably. But is I have heard numerous times, and again unverified, but I've heard numerous times that healthcare is the second most regulated industry, second only to nuclear, right? And man, I'm telling you, I can tell you if based on I've never worked in nuclear fire protection. I know several people who have, and it's very heavily regulated, clearly for a great reason. But I mean, healthcare is, we have hundreds of codes that we have to monitor and keep up with, and that's just on the facility side. That's not including, the medical side, the clinician side, the infection prevention side. There's so many aspects that goes into healthcare. It's incredible. It really is. So the inspection, testing, and maintenance of it, when is is critical, because the biggest difference in healthcare, I think this is important to note, is we aren't a standard occupancy. In a business occupancy, and I like to go back to kind of like the school kid reference, right? When the fire alarm goes off, you exit out of the building, and you all stand out in the parking lot because that's what you do. And that's how it is with most occupancies. But healthcare is a defend in place occupancy, and what that means is that once you enter a hospital, you're now a ward under our care, and that goes for patients, that goes for visitors, that goes for everybody. We are responsible for the occupants of that building, and we have, every floor is required to have a minimum of at least 2 smoke compartments for us to evacuate horizontally within that building. And I have only ever heard of a hospital evacuating, like personally, in the last few years at least, one time. And it was I won't get into why, but so we don't evacuate hospitals, and for just about any reason. The reason why is because of the potential increase of harm to the patient, both from an infection perspective, or just from for medical reasons. They're in there because they're sick. So everything that we do revolves around protecting the occupants of the building. So, and because of that, though, there's all of these inspection, testing, and maintenance requirements that go into managing our buildings and making sure that they remain safe. And it's everything from fire door testing to damper testing to fire alarm, sprinkler, special hazards, you name it. I mean, like I've seen all kinds of smoke control systems, so all kinds of stuff, and it's a blast, and it's everything from passive fire protection. So using and training your team and contractors how to properly use fire stop, which is, by the way, one of the like very commonly misapplied. So we get to work in the passive fire protection and active fire protection realms as well. So it's a blast. It really is. It's a lot of fun, but it's a lot of work. It's a lot of knowledge. It's a lot of going back and having to gut check. Because there's so much to remember that it's impossible to remember everything. So just knowing where to check stuff.
Oh man, that sounds like a lot. I was listening to one of your videos recently. I think it was the one about standpipes, and you were naming off some additional standards that I'd never heard of, and I can only imagine that those are standards or inspection, testing, and maintenance provisions that are from the healthcare specific codes and standards that you're referencing. So that's pretty remarkable, because it's already a complex enough equation if you're just working with the standard set of building codes and regulations and how that all gets applied. So that's pretty remarkable. I didn't know that about. I mean, it makes intuitive sense that there are additional healthcare regulations, and yeah, I don't know. That's really interesting.
Absolutely. Yeah, no, absolutely. And I mean, I just opened up, since I'm here on my computer, I just opened up my resource library that I have, and I've got over 200 codes and standards in there. So, and it's just one of those, you got to know where to go. You got to know because you can't remember everything. But one of the big things that also separates hospitals from standard business occupancies is that, or just really any occupancy, is that we're audited. So we are audited by either CMS, which is the Center for Medicaid and Medicare and Medicaid Services, or one of the accrediting organizations, DNV, Joint Commission. There's a few, HVAP, CLIA. There's a few. There's only four, but and we're audited regularly, depending on which one you follow. Depends on how often you're audited, but and it's brutal. It really is. I mean, they go through the gamut of like for our largest hospital, it's a 3-day life safety survey. They poke their head above ceiling. They go through all of our records. And we have to have all of our I's dotted or T's crossed, and if we don't, then you know, almost always, we're able to resolve it. But I've heard of several hospitals and read reports and stuff where funding has been reduced from government resources because CMS actually is the deemed authority that authorizes payment for Medicare and Medicaid services, which depending on where hospital is located can be up to 80% of the funding for the hospital. So it's significant. It's we're talking. Healthcare's a multi-billion-dollar industry, and making sure that we have those and we operate with very, very small margins. So us keeping our hospitals in check and up to the protective standards of the codes, right? All of the organizations all just tie back in some way or another to a code or standard somewhere. So as long as you're maintaining your equipment properly, then you're okay.
Yeah, that's interesting. The auditing aspect of it, I didn't know about that, but it seems like it adds a different factor into the mix for having to ensure that you're not only code compliant, but the record keeping and some of those things that in standard commercial occupancies are not. You might have trouble finding uh, traditional business buildings, records of their fire suppression, their fire alarm, or their, whatever, smoke and fire partitions. But I imagine that that's not something that happens in healthcare, and that you guys are very on top of record keeping and just the whole process of management of change and those type of things. But that's pretty fascinating.
It is, yeah, and it's we're better. I would say we're better than standard occupancies, of course, but we still have a long way to go. And that's a lot of what the videos and stuff are for. I gear them towards other healthcare facilities because of the auditing and the compliance and the importance so
Yeah, yeah, that's really fascinating. So I wanted to hear a little bit more about. I think I get a little bit of you know uh, what your role is as kind of somebody who develops programs for ITM and healthcare compliance. But yeah, I just wanted to. I'm fascinated by professionals who are have found their own way to make their own business in fire protection and be successful. So yeah, I just wanted to hear a little bit more about what you're doing at Legacy FM and yeah, where you guys are going with the business. That's really cool.
yeah, awesome, very cool. It's my other passion. So fire protection is one of my passions, right? And my other passion is education and training. And my wife, my and co-founder, started the company. She came to me and said, "Hey, was heavily plugged into healthcare and to facilities management as well. And she's like, I want to do this. This is something that needs to happen in the industry. Passionate about it. She's developed training and education programs before. And I was like, yeah, let's do it. We talked about it a couple of times and just pulled the trigger and said, let's go. And what we do is we go into hospitals, well, step back. So most of the education and training within hospitals is geared towards the clinical side. Almost all of it, right? So, and for a good reason. If you had a doctor or a nurse, that was taking care of you, you would expect that they are highly educated and continuously trained to make sure that they're doing the right things, right? It's very important. And then the level of facilities managers or directors of facilities, they get a lot of their education through ASHE, or through other organizations, NFPA. And there's a few others, but the facilities technicians are. It's very difficult to reach them because they're number one. Facilities management is a cost center. All we are is a cost to the hospital. We don't generate any income, right? Which makes it very difficult. We are an operations center, but we are just as critical and important as the doctors and nurses within the hospital because we keep the building running. We keep the lights on. There's a lot of regulations geared towards like temperature and humidity in operating rooms that we have to maintain and take care of, which is completely unrelated to fire protection. But there's a whole gamut of stuff that we have to verify to make sure that the atmosphere that we are providing for patients is a healing one, and it's geared towards their healing. And so, but reaching that level of technician from an education perspective is very difficult. The average technician is over 50 years old. We don't have a whole lot of people entering technical trades, and I'm a huge proponent because of my trade background and what it's done for me. I look at things differently because of that. If I didn't ever work in a trade, then I'm not sure that I would be where I am today. And I take that very seriously. And I love giving back to the trades. I mean, those guys are good as gold, and girls are good as gold. And they'll do just about anything for you. And it's amazing to see how they can walk up to something and figure out and solve an issue, in a matter of seconds that would take an average person, normally calling a technician to come and do it, but
Yeah.
uh, so, but so we develop these training programs though for these hospitals, to reach the technicians because it's very difficult to maintain a level of compliance. Like I'm the only fire protection engineer at Baptist. There's only one of me. There's other people that are knowledgeable in fire protection, of course, but I can't be everywhere at all 11 of our hospitals over 9 campuses at any given time. And that's how it is with all facilities managers. You know, um, our technicians are our eyes and our ears. They're the ones that are out there talking to nurses. They're the ones that the more that we can train them on code issues and compliance issues and why it's important and how infection prevention is critical in hospitals. From that's a whole other topic, but the more that we can train them on that and help them understand and see the importance of it, it then the better our hospital is going to be. And that's what our company does is we actually develop these training and education programs. We align it to their job descriptions specifically, come up with what we call a competency matrix, so that way all training is tied back to a core competency on their job descriptions. Help develop succession planning mechanisms with HR departments, develop the actual training for the hospital system. Our goal, we offer online training as well, but our goal is to do train the trainer. We want this to be a sustainable model for the hospital for years to come. And then we do pre-assessment and post-assessment and recurring assessments to make sure that knowledge is retained. And one of the things I like to say is that we're we don't really care about the education and training. We care about the retention and the results. And what we've seen, though, it's funny. We tell people all the time we're actually not a education and training company at all, and we are an empowerment company. We believe in empowering people through education and training. It just so happens that's our vessel to do it, right? We want people to do to have the knowledge so they're able to do their best and give back to society and to their hospitals and facilities and all of that.
Yeah, that's I like that piece about retention and keeping this knowledge base and having a succession plan because it's I'm sure it's hard. It sounds like already it's hard enough to get these technicians who are qualified and the work is very technical and difficult, and then also needing to keep this knowledge base up, keep your technicians up to date on their training. And yeah, that's really interesting. I didn't realize that all that some of the services that you guys are involved with Legacy FM. That's very interesting. I wanted to hear a little bit about. I see that you're on a couple different committees for the NFPA standards or codes and standards, specifically applying to healthcare. Yeah, I'm really fascinated about the codes and standards development process. Yeah, I'd love to hear about that.
Yeah, absolutely. I love it. I absolutely love codes and standards development. I think and it's gotten me to the point where I actually now read the federal registrar, for submission to CMS as well, because what drives, but I'll get into that. So, it's a I actually sit on I think 5 NFPA committees, and I also sit on the Healthcare Codes and Standards Review Committee, which is basically kind of I think the phrase is like we're the watchdog of healthcare codes and standards, and we keep an eye out for changes that are coming and looming. And man, I was very blessed. Somebody got me involved in this, and I dug right in, and it just really when they heard kind of like my story and background of why I love this. I hate when codes and standards are developed because of a tragedy. I mean, we've had so many fires. They're all over the news. Beirut and Notre Dame and all these terrible tragedies where we implement codes and standards after the fact because of those, and some of them are unpreventable. But many of them, we sacrifice human life before we take it seriously. And that's codes and standards development that's our chance to change it. That's where we can stand up, and every single person can make a difference. Any member of the public. It doesn't have to be a fire protection engineer. You don't have to be on a committee. You can submit public input, and you can drive change. And that's what I love about it, is that everybody has a voice in that you can be heard. And I just love the whole history of it. Like I was fascinated and did a ton of research on how the Safety to Life Committee was formed after the Triangle Shirtwaist Fire in New York. And that's what really got me like loving all of this was in the beginning. I like to say, like, there were a whole bunch of people way smarter than me that decided to form this committee to save lives. And man, that I got a ton of respect for that. I do. But not everything that was put in the code had scientific reasoning behind it. Some of it is there's no scientific basis to it, and a great example that I like to use is the smoke compartment change in NFPA 101. We used to only be able to do 22,500 square feet for smoke compartments, and in the 2018 edition of code, we're now able to do 40,000 square feet. And you know, do you know where the 22,500 square foot comes from?
No idea.
Yeah. So uh, the committee, and I don't know when it was, but it was years ago. The committee back then was made up of primarily men, and what they did was they said, well, we need to separate out these smoke compartments, and well, what size should we use? So what they did was they took every man of the committee and made them hold their breath and walk as far as they could. Well, the average was 125 feet. So we used a smoke compartment size of 125 feet by 125 feet, which was 22,500 square feet. So,
Wow.
and yeah, and there's no scientific evidence there clearly at all, right? So that doesn't mean that it's not a great idea, right? But now we have scientific evidence, and now we have, so one of the big things that I try to push when people are proposing changes is, okay, what's the scientific reasoning behind that? Unfortunately, there's a lot of manufacturers that really take advantage of this from a profit perspective. They'll go out and put things in there that don't make any sense. But it's just, and it's kind of this, and luckily, people are getting smarter and kind of wising up to it. But they'll put it in there and make it specific. Like somebody will say, "Oh, well, we have to do this specific UL system. It has to be UL listed to this," and there's only one manufacturer that makes it, right? Well, we can't do that. I don't. I mean, it's sometimes things like that get voted in, right? But it's it takes people putting up a fight for what's right, and that's what I love about the codes and development process is that anybody can do it. Anybody can say this doesn't make any sense and it needs to be different.
Yeah, I think that's a good point. Having stuff that's sole sourced through one UL listed process is it sounds like not a good thing, not a competitive environment, not
That's
an
right.
environment for systems and technology that is sustainable and has life safety first and foremost. But yeah, that's interesting.
It's a lot of fun. It is. I mean, and luckily, I'm able to be heavily involved. I sit on ASHE's regulatory affairs committee as well, and I'm able to be heavily involved in kind of like the research processes on how we're doing this. And because I have such a large healthcare system that I do life safety for, I'm able to provide a lot of data as well. And so a good example of that is like, something that doesn't make any sense to healthcare specific is monthly fire extinguisher checks. In 5 years, I've had 8 failures on my fire extinguishers, and that's it, 8. And it's taken me an entire FTE over 5 years, not each year, but a fifth of his time is dedicated to checking fire extinguishers for 8 failures, right? Well, if we're in an industrial environment or a more corrosive environment, then yeah, I may need to do monthly or even weekly. But code says that like the minimum I can go is monthly. Well, I'm spending a ton of time and effort to check extinguishers that it doesn't make any sense for us to check, right? Because now we have scientific evidence backing it. So that was actually proposed for the most current edition of NFPA 10 is, hey, we want to make some changes to this specific for healthcare. So it's really fun being involved in that whole process, though, and I highly encourage others to just to jump in and do it.
Yeah, it's cool that we live in a time where we can make data-driven decisions about fire protection and life safety, and we don't just have to have anecdotal rule of thumb knowledge guide what is right for codes and standards. But that's really interesting. So I know we talked about it a little bit in the beginning of the interview, but I wanted to talk more about your instructional videos that you've been doing. For those who don't know about the kind of videos that you've been putting out, yeah, to maybe give some people an idea of what you've been doing on social media and kind of the goal or what's been going on with your videos. I've been really enjoying them.
Well, that's awesome. Thanks, thank you. So yeah, I started. I don't even know like really when it started, but somebody said, "Hey, you should do a video on that," and it was something. It was something I don't remember what my first one was, to tell you the truth. But and it started out, they started out pretty rough, and I've learned a lot since then. But it's everything that all the videos that I'm doing are all related either to fire protection or towards healthcare facilities management, and it's like day to day stuff that um, somebody may not know, and it's something. A big part of it is things that I've learned as I go along, or things that somebody sends me questions now, and I love helping other people research and find the right answer. So and I'm like, look, if somebody's asking, or if I'm asking, right, then there's got to be others out there who are asking or need to know this. And it's been, some of them have been kind of simple, and some have been more complex. But I love taking complex topics of what people think are these big scary, like fire alarm programming is a great example. Like so many people think this is just this kind of like terrifying, it's the fire alarm program, and it's just, no, it's really really simple. It's just if then equations, right? That's all it is. It's if this happens, then these things need to happen downstream to make sure that we've got a protective atmosphere. But just taking these topics, and kind of breaking it down and showing people, code doesn't isn't always the best at like this kind of visual representation, right? Of understanding how to do it. They're great at writing out the steps. So are manufacturers, but the visual component of that, some people need to see it in action, and see that it's not this daunting task, and see that here's how you can do it. And I love taking those opportunities. And a big part of it came from developing our ITM program for our hospital system. Where we are, as far as I know, at least, we're the only hospital system in the nation right now that does integrated um, system testing, which is required um, by for high-rise buildings, by once adopted at least by NFPA 101 2018, and the newer edition coming out to the 2021. And integrated system testing is, in the past, ITM has always just been individual systems. We're going to test. We send out somebody to test sprinkler systems to NFPA 25. We send out somebody to test um, uh, portable extinguishers to NFPA 10, fire alarm systems to NFPA 72, fire doors to NFPA 80, so on and so forth, right? Well, integrated system testing is where the fire alarm system really comes in. It's the web that connects everything together. If I need to close these smoke doors when this smoke detector goes off, then I've got a fire alarm relay downstream, tying all of that together. So, kind of breaking all of this down in these videos and showing people how to do it, the proper ways to do it, common issues that I've seen or that I've heard of um, in the industry. Sometimes we're talking about the contracts, the contract language. Sometimes we're talking about generator testing. Sometimes we're talking about standpipe testing. It's just kind of, it's all over the map. But it's just one of those that I know that somebody in college, one of our professors at OSU taught me, and it was actually Professor Pat Brock. I don't know if you ever got the chance to know him or not.
Yeah,
Um,
I know Pat Brock. I didn't have him as a
yeah,
professor, but I did know him. He's a legend at OK State.
he is. He is. And he is the godfather of sprinkler hydraulics. So, but he taught me, if you have a question about it, then it's highly likely that somebody else does, right? And I really took that to heart, and I try to live that, and the thing is that so many people comment on my videos and improve them, right? This is not just me out there trying to do it. There's a ton of people that comment and say stuff, and I think every single video I've learned something new, either through the research process or through somebody commenting and saying, "Hey, think about this," and that's really what it's about.
Yeah, that's awesome. I feel very similarly about Fire Code Tech, and it's of course it's awesome. I get to highlight different individuals and different topics in fire protection and life safety. But yeah, it's a chance for me through every interview, I always get to learn something. And even when I'm going back and editing the episode, I usually learn something else that I even missed, even though I was the one interviewing at the time. There's a lot of wheels spinning, so it's fun to be a part of putting resources out into the space for professionals. I think it's as much about individual development and professional development for the one producing the content as those who are getting benefit out of just watching the content as well. That's pretty special. So I wanted to talk to you about, I think I'd be kicking myself in the pants if I didn't ask you about how you guys have been doing in COVID and how like the pandemic has changed things for you in facilities management. I feel like I try to stay away from COVID as much as possible because I'm sure people hear about it every day. But yeah, I feel like it has had to have had impact on you in some regard, right?
Huge, yeah. It's hit the healthcare industry very hard. I mean, some luckily our hospital system is was very financially secure, and we're not having issues that some other hospitals are. I've seen news stories and things like that of hospitals shutting down or converting to psychiatric hospitals or converting to you name it. And man, it's been very difficult. And I'm very we're also very blessed here in Arkansas that we didn't have we weren't overrun. Like, I've got a really close friend who's also a fire protection engineer up in New York, and his hospital system. I mean, he was averaging like 4 hours of sleep a night for like 6 weeks. I mean, it was really hard. It was really hard up there, and so luckily we didn't have that peak here. But that doesn't mean that it hasn't changed things forever, right? And we are going to see the ripple effects of this, not only just economically or in all of this, but from codes and standards and all of it for years to come, right? And which is why one of the reasons I'm advocating so hard for codes, because I mean, I think everybody's seen just a great example is everybody now sells masks, right? Everybody produces masks and sells this PPE stuff, right? And it's become this this lucrative way for people to make money. Well, it's going to be the same for filters, for air handling units, for all kinds of stuff. You name it, right? UV. People are going to try to. There are unfortunately people out there who see this as an opportunity to profit, and they're going to try to use the codes and standards as a way and a mechanism for them to do that. And again, if there's scientific evidence and research, then fine, let's do it. But let's not just do it just because somebody says it's the right thing to do. So yeah, we have. There's been one of the biggest changes in healthcare. There's two actually. There's two that well, there's a lot, but there's a few that I like to focus on when I'm talking to people. Clearly, the negative pressure issue, right? One of the things that I think is going to be coming in the codes is the conflict between having smoke dampers at all of our shaft locations and things like that. Smoke and fire dampers when we have like an active, what we'll call pandemic or COVID unit or whatever, right? It could be the next COVID, who knows? But there's this conflict between the fire side where we have a potential for like a faulty alarm closing down air resources, right? For exhaust purposes, and then or shutting down the air handling unit and keeping that going. The last thing that we want to do is contribute to spreading, right? So one thing that we were actually able to do from an ITM perspective, it's called an 1135 waiver from CMS, which means basically that we don't have to follow the code as long as we properly document and do a risk assessment of why, right? So we continued actually doing all of our testing and maintenance for our hospital, except for anything tied to air handling units serving our COVID areas, right? So, and the reason why is it's just not worth it. It's not worth taking that chance and that risk, knowing that I know that the devices were working a year ago, right? So, and then there's also been a huge increase in plexiglass in hospitals, and hospitals are primarily, non-combustible. They're required to be non-combustible construction, and So we've had this huge increase of plexiglass, which doesn't. It's very hard to find a plexiglass that meets the smoke development or fire development index ratings, right? Flame spread index, and I'm curious how that's going to change in the codes as well. And there's several other factors, of course. We have a lot more vacant spaces. I think design specifically will forever change for hospitals. I think these elaborate lobbies and atriums that we're used to seeing in hospitals, the hospitals 5 years from now, I highly doubt that we'll see that.
Yeah, that's fascinating about some of the different ITM things with the air handling units. I know that we've been in the process of buildings that I'm designing currently. We're looking at, different like vestibule slash entry configurations in order to facilitate testing, and like a room maybe that might be for individuals that could be experiencing symptoms. And so yeah, it's definitely changing the industry irrevocably. So it's pretty interesting to hear you talk about some of the impacts you've been seeing for healthcare facilities. But Josh, I want to be mindful of your time, and I just want to say thanks so much for coming on the podcast and talking to me about what you're doing. I think that the work you're doing is endlessly fascinating, and yeah, I hope you keep up the videos and the good work. But yeah, I just want to say thanks, sir.
Absolutely. No, thank you for having me.
Thanks for listening, everybody. Be sure to share the episode with a friend if you enjoyed it. Don't forget that fire protection and life safety is serious business. The views and opinions expressed on this podcast are by no means a professional consultation or a codes and standards interpretation. Be sure to contact a licensed professional if you are getting involved with fire protection and or life safety. Thanks again, and we'll see you next time.